Kia ora, everyone. Welcome. Nice to see some of the same people back again. Nice to see some new people joining us today. We've got more coming in, but we'll just get started because we've got so much great information to share today. So I'm going to open our session with karakia to call in positive energies. Tu taua mai I runga, tu taua mai I raro, tu taua mai I roto, tu taua mai I waho, kia tau ai te mauri tū, te mauri ora ki te katoa. Haumie, hue, taike. Well, kia ora koutou, welcome to this Evidence to Practice session. Ko Cheryl Han toka wingwa, he tangata tiriti aho. I'm with the Centre for Family Violence and Sexual Violence Prevention, formerly known as Te Puna Aonui, and really happy to be the facilitator with you here today. We're using this version of Teams for this hui today, where you can see the presenters and you can ask questions through the Q&A function, but you can't use the chat or other functions. So please use those Q&As, ask questions, and we'll be able to have the opportunity to hopefully have some of those answered as we go through. With today's session, we're really pleased to welcome Marina Carmen from Victoria, Australia, who's going to be presenting on the evidence base for prevention of family, domestic and sexual violence experience within LGBTIQA+ communities. And then you're going to have a chance to hear the answers to some of your questions, and that's going to be facilitated by Eleanor Butterworth, who's the Manager for Enabling Communities here at the Centre for Family Violence and Sexual Violence Prevention. And many of you will know her from her work in communities around Aotearoa and the prevention space. Just to remind you that the Q&A is public, so people online are going to see it. And we want to also be thinking about keeping this place a safe and inclusive space. These sessions are going to cover topics of sexual violence and family violence that can be difficult and distressing to people. So please do what you need to do to look after yourself and get the support if you need it. We're going to post the links to the help portals where you can phone or online chat or connect with people who can provide you information about and support. So now I'm going to hand over to our presenter, Marina. Marina Carmen is the Executive Director for the Prevention, Advocacy and Social Change at the peak body in Victoria, Australia for family violence, which is called Safe and Equal. She's also worked as the Director for Rainbow Health in Australia, where she led the development of Pride in Prevention. And she's the author of many resources that we've been having a look at, and resources and reports that are about the prevention of violence against LGBTQIA+ communities. So Marina, I'm going to hand over to you for the presentation. Thank you so much for joining us.
Thanks so much. I think I've got my slides coming. Lovely. Thank you so much. So yes, my name's Marina. I use she, her pronouns, and that's my position there. But I'm very lucky to have worked for a long time in research policy and practice related to preventing violence against LGBTIQ people. Next slide. I'd like to start by acknowledging the traditional owners of the lands that I'm coming to you from today. For me, it's unceded Wurundjeri lands, and pay my respects to elders past and present, always was, always will be Aboriginal land, and also acknowledge the lands that you're all coming to from today and the ongoing need to address discrimination and the impacts of colonisation and violence against First Nations peoples across this wonderful land that we all live on. So the three main things that I wanted to go through quickly today. The first is just to look at the current evidence base related to LGBTIQ experiences of violence, the drivers of violence against LGBTIQ people, and also the priority actions for change. Just on to the next one. Lovely. So, first thing that I want to say whenever I give a talk on this issue is we need to remember that while we spend a lot of time talking about the bad things that happen to LGBTIQ people, it's really important to remember that it's not all bad. There are wonderful things that LGBTIQ people experience. They are unique, they are gorgeous, and there's a lot of research that looks at the positive aspects that people learn through building, loving relationships, conscious community connection, choosing family, discovering themselves, and also experiences of affirmation and how positive those can be, right through to the wonderful experience of gender euphoria when you come out the other end of social expectations and can experience your gender in whatever way makes you feel loved and happy. So I think it's really important to remember this as we go forward. So in terms of looking at the state of the evidence-based base, I'm really lucky. I'm in a good position to do this at the moment because there is a process that's happening in Australia of producing a national framework for the prevention of violence against LGBTIQ people. It's a collaboration between Rainbow Health Australia that I used to lead and Our Watch as Australia's national primary prevention of violence against women organisation. And I was engaged recently to help lead the writing of that framework. And so we did a pretty fulsome literature review. This was building on the literature review that we did in Pride in Prevention. And although we didn't really find anything much new from Pride in Prevention, which was done, the literature review was done in around 2020, what was really heartening is to see how much more research there is out there. That this is a topic that has been under-researched historically because of the exclusion experienced by LGBTIQ people. So there's good news. There's good news in this area in terms of the current state of the evidence base. But what's really important to note is that particularly in Australia, and it may be a little bit different in New Zealand, but in Australia, our population level prevalence data is quite limited. And that's particularly, we're in terms of our national census, for instance, we're only just getting to pilot questions that would include the breadth of LGBTIQ identities and experiences within our census. The main survey that we use at a population level is our personal safety survey. The last one was done in 2020, which did for the first time allow an analysis of experiences for women with diverse sexual orientation, but it very much still uses binary gender questions, which limits our ability to understand the experiences of trans and gender diverse people within Australia. Regardless of this, what we do know is that there are higher rates of physical violence, sexual violence, and harassment experienced by LGBTIQ people. As I said, there's a growing amount of research internationally. A lot of it is in Australia, the US, Canada, and the UK. And what we're getting is a pretty consistent picture that says that intimate partner violence is the same. And in most cases now, what we're finding is higher than heterosexual and cisgender counterparts. And it's especially high for bisexual people in general, but particularly bisexual women and for trans and non-binary people. What we're also seeing is significant levels of sexual violence. There's some great work that's been done in Australia in the Trans and Gender Diverse Sexual Violence National Survey. Really significant levels of sexual violence, unfortunately. And also a number of our surveys around sexual harassment show that it's quite high for LGBTIQ people in comparison, again, to heterosexual and cisgender counterparts. What we've been within the sort of context of the lack of population level research through our Bureau of Statistics, what we've seen that's been really important in Australia is some LGBTIQ specific research that has really filled in some gaps for us around the specific experiences of LGBTIQ communities. This particular survey is really worth looking at. It's got a chapter on experiences of violence. It's called Private Lives. It's run, I think, around every 5 years or so, and we're on to the third. The fourth has just been funded. And at the time, it was the largest survey of LGBTIQ people that had ever been conducted in Australia. And what we found in this is that around 4 in 10 participants reported intimate partner violence, almost 4 in 10 reported family violence, and more than 4 in 10 of these reported that violence was specifically targeted at them because they were LGBTIQ. And beyond this, what we found was really significant broader experiences of stigma, discrimination, abuse, harassment, and social exclusion. We also found, looking at this from an intersectional perspective, is that within LGBTIQ communities, those who experienced overlapping inequalities and sources of discrimination and oppression were more at risk of experiencing violence. And that included, and this is from Private Lives and some other research as well, particularly Aboriginal and Torres Strait Islander communities, people from refugee and migrant and multicultural communities, people living with disabilities, young people in particular, within within their homes, and it's related to experiences of homelessness for young people, and also people who had lower access to income, employment, and housing, that their experiences of violence were particularly acute. And this is from a small number of other studies in Australia and internationally that have started to really zoom in on these different experiences within LGBTIQ communities and overlapping experiences. But we'd have to say that in similar ways that LGBTIQ people have been excluded from a research focus, there's less research looking again at this sort of intersectional experiences and analysis of violence. The other key insights from Private Lives that are worth sharing is there was a particular gap in LGBTIQ people being able to recognise and name their experiences of violence. So when we asked them, participants, to say, have you experienced intimate partner or family violence, they would say no. There was around 20% who would say no. But then when you asked them, have you experienced these particular things that might indicate that they had experienced intimate partner or family violence? The number of participants who had actually had these experiences rose from 4 in 10, as I said before, to 6 in 10. So there's a big gap there in terms of people being able to name and understand their experiences as violence. There were also big barriers to reporting. Only about a third said they'd reported the most recent incident, and a very small number reporting to family violence and domestic violence services or to medical professions. And importantly, only 2/3 of those who did report felt supported when they did. The other key thing that came out of it was preferences for services. So there was a significant number who said that they would prefer to access a mainstream domestic or family violence service that has gone through steps to become LGBTIQ inclusive, and around 20% said from a service that caters only to LGBTIQ people. So we have a number of really important LGBTIQ community-led family violence services, particularly in Victoria, and trans and gender diverse people were much more likely to want to access an LGBTIQ specific service. But the preference for mainstream services that were LGBT inclusive was often a factor when people felt that they were worried about the perpetrator finding them, given that the communities are quite small and quite connected, intimately connected. So, as I said, going through this broad range of research that we now have to work from, there are some important gaps, and they're particularly in prevalence data, The experiences of people with intersex variations is also a significant gap, although there are a lot of indications that people who with intersex variations are subjected to sort of normalising medical interventions, and there's a lot of advocacy around that as a abuse of human rights. And also understanding and intervening with people who use violence. So not only people who are not LGBTIQ using violence against LGBTIQ people, but LGBTIQ people using violence against other LGBTIQ people, and understanding the complexities of that. So next I'm going to go on to talk about the drivers of violence. And we have a pretty strong focus on that in Victoria. I'll just go on to the next slide because I've got to remember what order I was doing it in. Okay, yes. So I'm sure that many of you, or you would, this audience would be quite primed to understand primary prevention, but really it's an approach that comes from a really significant history of public health approaches that look at the sort of social determinants of outcomes in terms of health, safety, and well-being. In Australia, there is a national support for this as an approach, and we've particularly been able to implement it a lot in Victoria, where we're focused on activities that change the underlying social conditions that produce and drive violence against women, and working across the whole population to do so. So that the primary prevention approach in terms of violence against women is reasonably well established, even though it's a relatively new, really only over the last decade in Australia and Victoria that we've had substantial funding going into these sorts of programs. So Change the Story is our national framework for the prevention of drivers of prevention of violence against women, and really from a really solid review of the literature has isolated these 4 particular drivers that make violence against women more likely, make it more likely to be condoned, perpetuated, and excused across society. And this Change the Story gives us a good view of actions that then need to be taken to address these drivers of violence. In the second edition of Change the Story, which was released a couple of years ago, for the first time, LGBTIQ communities were integrated in a more fulsome way within the approach, the primary prevention approach, with an acknowledgement of the sort of overlapping drivers of violence experienced by not only LGBTIQ communities, but other communities as well, who are impacted by racism, ableism, the impacts of colonisation. And I'll talk a bit more about that in the next slide. So in terms of supporting this approach and looking at the intersecting drivers of violence, we are lucky enough to have a really great range of companion resources to changing Change the Story. So we have Changing the Picture, which looks at the experiences of Aboriginal and Torres Strait Islander women, Changing the Landscape, that looks at women living with disabilities. We have a great resource from the Multicultural Centre for Women's Health that's called Intersectionality Matters, that looks particularly at the experiences of migrant and refugee women. And then we had Pride in Prevention that my team led and was released in 2020. So really what we've worked towards in Victoria is getting that sort of detailed analysis of the overlapping drivers of violence that not only enriches the prevention of violence against women for all women, but allows us to integrate an understanding of prevention of family and gender-based violence for people of all genders. So in Pride in Prevention, the key things that we put forward was looking at these shared drivers of violence. So the commonality in the drivers of violence against women and the drivers of violence against LGBTIQ people. And really what we identified were these critical shared drivers of the rigid binary and hierarchical norms around gender and sexuality that essentially put forward the idea that male, female in a heterosexual relationship with children is the only normal and natural way to be, and that there's something wrong with people who exist outside of these traditional norms. And also we looked at the role of homophobia and transphobia in reinforcing norms around masculinity, that, you know, you can't be, that to be gay is to be feminine. And particularly we're seeing in Australia, and you may well be seeing it there too, is the real transphobia as a way of enforcing masculinity, particularly in male-dominated environments. That transphobic backlash is really critical, particularly amongst young men in, you know, establishing themselves as strong and, you know, those sort of harmful norms around masculinity. In Pride and Prevention, we also looked at some drivers of violence that are more specific to LGBTIQ communities, really focused around things like the lack of visibility, the obscuring and minimising of violence, and stereotyping around LGBTIQ experiences of violence, such as, you know, that you can't have violence in lesbian relationships, or it's not important if it happens between, you know, it's that there's not a power differential if it's two gay men, those sorts of things. The other drivers of violence in terms of the sort of the lack of rights and equality, particularly around bodily autonomy for intersex and trans and gender diverse people, and then a range of social norms that validate the inequality and exclusion. So where LGBTIQ people are less equal, less valid, they are therefore a target for violence, and a target for the sort of reinforcing of these traditional and gendered norms. The other thing that we looked at a little bit is the looking at how gendered cultures of violence, so the way that power can be used in a relationship against someone, can be reproduced. You know, we all grow up in a gendered society and reproduce those norms in a unconscious way within our relationships. And that also happens within LGBTIQ relationships, where regardless of gender, one partner may or may not adopt particular behaviours that may be controlling, aggressive, and that, so in that way we've talked a little bit about the cultures of violence that are reproduced within LGBTIQ relationships, but in complex ways that you can't make assumptions about. So what we're hoping to do in this forthcoming national framework, let's go on to the next slide. So in the forthcoming national framework that I talked about, we have built on Pride in Prevention to more to clarify and spell out the drivers of violence specific to LGBTIQ communities and the overlap of those drivers with violence against women. And the drivers really show us what needs to happen in terms of actions to address violence against LGBTIQ communities. One of the critical things is really increasing understanding. As I said, the lack of a research focus, the lack of a policy and investment focus on the experiences of LGBTIQ communities is something that happens within the family and domestic and sexual violence sector as well. It happens within government. So needing to really make that effort to understand violence experienced by LGBTIQ communities as a basis to not making assumptions, really getting where the violence is coming from, and often it's not from within LGBTIQ communities and it can't be solved within LGBTIQ communities. It's actually change that needs to happen across society, and particularly with cisgender men, which is still where the majority of violence experienced by LGBTIQ communities comes from. The drivers and that the actions also very much need to have a focus on delivering human rights. A really critical advocacy point for violence against women was looking at freedom from violence as a human right. and asserting the rights of LGBTIQ people to live free from violence is really important. There's not the same sort of international architecture at the UN level around that, but those rights are still really important to advocate for, and particularly including the right to bodily autonomy is a key part of preventing violence against LGBTIQ people. The actions really do involve needing to look at a government commitment. As I said, this area, even within Australia, where we've had a long-term investment and attention to these issues, the commitment to including LGBTIQ communities within violence prevention approaches is really at its very beginnings. There's one funded program in the whole of Australia that looks at this issue, and that program is about to finish. So there's a real need to look at government commitment. As I said, it's also about looking at actions not just for LGBTIQ communities or within LGBTIQ communities. It's about looking at changing that broader context that drives violence. The other critical thing has been working with the sectors that have grown up to look at the prevention of violence against women, to find ways for those sectors to relate to and integrate and work productively with the sectors that have grown up that look at LGBTIQ rights, health and well-being, and making sure that those sectors are in no way competing and in no way trying to detract from each other, but very much looking to work together in a shared interest to change these really significant social norms. So yes, those are the key things that I want to say about the actions, I think. And what else have I got? That's it, I think. So hopefully that gives you a little bit of an overview of the work that we have been doing. It's not finished in any way, but I think we've made a lot of headway in understanding these issues, being able to talk about them, being able to offer some practice guidance, particularly through we had Pride in Prevention. We've since released a number of different practice guides that looked at messaging, partnerships, evaluation, and we're about to launch another looking at programming. The not only the understanding but the practice around these issues has really been able to move forward quite substantially in Australia, but there is a long way to go.
Tēnā koe. Marina, thank you so much for that presentation. That was really really fulsome, and as someone who's spent quite a long time working in the prevention space in sport and in community, those kind of resources are so invaluable that really say these are the things that we need to target if we want to shift this. So I'm just going to invite, if people want to put any questions into the Q&A function, we can start asking those. But one thing that I would love to hear from you is, have you seen any really great examples of the ways communities have taken those drivers and started to address them, or taken the evidence and addressed them within their own community?
I think a really good example is actually sports settings. So there's a really big overlap between we've had a lot of a focus on pride in sport and a lot of focus on addressing violence against women in sport. And increasingly, practitioners in both those spaces are finding that the backlash and the resistance that they come up against is really intertwined. As I said, the ways that homophobia are used to reinforce masculine gender norms, but particularly more and more and more transphobia being almost taking over as a sort of way that backlash and reinforcing of masculinity is enforced. So I think that there's been a lot of resourcing going out into community level sports and supporting clubs to to look at pride and to look at gender equality within their practices as a club, but the broader work that they do within their communities. So that's one example. I think the other is that particularly in Victoria, there was a lot of, when I first started working in this space, maybe about a decade ago, almost all of the programs and organisations were very, very specifically focused on violence against women. And there was this uncomfortable moment where we came along and said, we're not trying to disrupt this at all, but how can you include us? And while that was an uncomfortable initial engagement, in Victoria, we found that all we had to do was come in and say, we're not trying to take anything away from feminism. We're not trying to disrupt any of your existing work, but how do we work together around this and really acknowledge the centrality of gender norms and norms around sexuality that actually screw over women and screw over LGBTIQ people at the same time. And I think we've seen a really good advancement in that common work, particularly in Victoria. But as I said, it's not a finished product.
Yeah. The point that you made, just sort of following that thread about, one of the things that I've seen as communities start to try and do this work, particularly in sports, as you talked about the backlash. I've also seen that often as communities start thinking about prevention, then they have all of the existing abuse or homophobia or that sort of thing that already exists that they suddenly realize they need to deal with. And then there can also be the criticism of, tokenism and those sorts of things. What sort of supports do you think are really helpful for communities wanting to embark on this work, knowing that they'll probably get one of those three things at least coming up?
What my team within Safe and Equal is lucky enough to have been funded to do a sort of statewide workforce development program. And so a lot of what we do, we produce resources that are about giving people tips and tricks and ways to convince people and change people's minds. But the other really key focus that we have is a focus on well-being and actually really paying attention to that in this work, and that it's not just an individual responsibility. As organisations and a sector, we have to make sure that as we're sending people out there to convince others, that it's hard work. And, it's skilled work, but it's really hard work. So we run a lot of communities of practice and events where we bring people together. And I think that chance to connect, because often it's one person or it's two people going out there and trying to change things in their club or their workplace or that sort of thing. But it's really feeling like you're part of a collective endeavour and having that chance to talk with others. We just find that that's so important for this work.
Yeah. That's a great point. I know one of the things that we found as a real game changer in the work that we were doing was when we stopped targeting roles like the captain or the coach and started looking at groups of influencers within a space so that people weren't doing it on their own or they weren't trying to shift this whole thing by themselves. Now, I can see we've just got a question in the chat, so let me read this out. So you mentioned that increasing understanding of violence is an important action, including helping people within the LGBTIQA plus communities understand what behaviours are violent. Can you give us more detail about what works for increasing understanding? We know it's not just about telling people.
I think that the key thing is, as professionals and practitioners in this space, coming to grips with the evidence base is really important, because even in ourselves, we're often having to unwrite assumptions about what violence looks like for LGBTIQ people. Like I talked about, there's often that assumption that when we talk about LGBTIQ experiences of violence, that it's within LGBTIQ communities rather than coming from without. That most experiences, for instance, trans women mostly experience violence from cisgender men. Same with bisexual women. In terms of family of origin violence, it's mostly violence that comes from cisgender men or people from outside of LGBTIQ communities. So I think that even for practitioners who've been active in this space for many, many, many years, that getting that greater understanding of the realities of LGBTIQ experiences of violence is really important. And then from there, it's about finding good ways to communicate this. And a lot of it comes down to that messaging, where a lot of the time what we find is that messaging around LGBTIQ experiences of violence often reinforces the pathologization of LGBTIQ communities. It's a lot about talking about how bad things are, how things happen to you, how your relationships are a bit bad in some way, or that there's something wrong with you. And so we talk a lot about needing to have really strengths-based messaging, values-based messaging that talks about the future that we're trying to get to and the great things that are already happening that can be built upon. So I think really understanding the problem and then finding good ways to communicate around it that aren't reinforcing that problem is the key. Yeah.
Yeah, I was thinking when it comes to from within the LGBTIQ plus communities, I was thinking that invisibilizing is like a double-edged sword, where it's not necessarily making the types of violence visible, but it also means that we don't have the role models of the wonderful, healthy relationships that we can celebrate as well, and and are upheld. Yeah. I had another question. I will go with all of my questions here. One of the things that I'm really interested in, you talked about the drivers. Is there particular drivers that you think we should prioritize when we're trying to address this stuff, particularly at community level? Is there things that we could be doing to help sustain change, as opposed to, say, one-off events or walking in pride parades, those sorts of things, which are really important as well, important sort of symbolic actions? But yeah, what can help with sustaining that change and helping it go deep?
I think it really just comes down to those deeply held norms around gender and sexuality, and that being at the center of everything that we do. And there's such great experience and understanding that people have in violence prevention around those norms when it comes to violence against women. It's not, sometimes it can feel like, oh, well, I'm not sure how to talk about LGBTIQ communities or how to talk about violence experienced by LGBTIQ people. It's the same stuff. It's the same things. So all the work that people do to address those gendered norms in all different settings, lots of different tactics, it's just the same stuff. So I think the other thing is that a lot of in the LGBT, I don't know the context in New Zealand that well, but, in Australia we have a lot of organisations that they haven't gotten great amounts of funding and support to do this, but they have been supported to build LGBTIQ community-led services and organisations, and often in, rural areas, or, like lots of different community level stuff that happens, but connecting those two spaces and sectors together, like there's lots of common skills and common interests and great alliances that can really be built to do that kind of work.
Awesome, thank you. Now I've got another question coming from the chat there, which is, you spoke about cultures of violence and you also mentioned First Nations people and colonisations. What are your observations about how these interact with each other and LGBTIQA+ communities?
I think the sad reality of it is that we don't know enough. We have some ideas that I was reading when I did this literature review recently, was looking at there's a very small number of articles that deals with Aboriginal and Torres Strait Islander LGBTIQ sister girl and brother boy communities. But a lot of the issues are the same in that there are these really significant experiences of social inequality, oppression, discrimination, and those impact the violence that people experience within communities. So even within Aboriginal communities, LGBTIQ people may be excluded or even experience violence from other community members. But that this sits in this big context of, how communities and lives and people have been torn apart by colonisation. And the solution to it is really building that community connection, community-led solutions, and breaking down, discriminatory ideas around gender and sexuality so that there can be a cohesive, supported response to this and reduce violence within community, but then also from outside of community. So I think there's some common experiences that LGBTIQ communities have and Aboriginal and Torres Strait Islander communities have, and the solutions are similar in a sense that you've got to listen to those communities and build those communities.
Nice. I know some of the things that I've seen in New Zealand has been that it's just the reclaiming of pre-colonial sort of sexuality and gender, which is so often more inherently protective and inclusive and far less, a lot of the rigid ideas came with the colonisation as well, which is I've seen some incredible movements in that space as well around the intersections. I think for years from New Zealand, we've kind of watched the prevention work in Australia with envies might be too strong a word, but like I've always loved how much, prevention has had the focus and, how significant things like change the story was. Do you have any thoughts on how you move to a prevention lens over that sort of response and crisis? Because, the needs of crisis are always so pressing. Like prevention can feel like a nice to have, even though we know it's a critical part of what we must be doing. Have you got any advice or thoughts about how that shift starts to happen?
I do. And I'd also say it's an ongoing process here. Like continuing to maintain that focus on prevention is really, really hard. Because we're not funded anywhere near enough yet to really reduce demand on services. So it's where even though we might seem like we're further ahead, it's the same stuff. I think really that taking that human rights aspect as the initial one, I just think is so important. In some ways, we sort of think we're past that point of needing to say women's rights, LGBTIQ rights, we're not quite as far along there. Like it's very much let's get them first. But even in terms of women's rights, I think we've moved away from that human rights framing, and perhaps we need to bring that back a little bit more because it's being pushed backwards. So, I think that human rights framing is really, really important. But I think placing prevention in that tradition of let's let's take social responsibility for this problem, that it's not just something that services can fix. It's too much weight on them. It's not fair, and it will just keep happening. So getting that sense of momentum around it being a social problem, which is hard. It's just always so hard to get people to lift up and look at that. But it's a continual battle for us, and will be going forward.
Yeah. Well, it's amazing all the work that has happened in that space, because I do think it gives us something to learn from, and and to see. And the number of times I think we quote things like Victoria has, or yeah. Now, is there any? We're in our last few minutes. Is there any final questions from the audience? Otherwise, what I might do is just see if you have any kind of final closing, kind of remarks or thoughts, or reflections that you'd like to share with us.
I think the main thing I'd say in this space is just give it a go. I think there's a hesitancy sometimes in talking about or doing stuff in this area, but there's lots of support, and there's lots of resources, and lots of people that you could connect with to integrate this into your work or do more around it. So I think in the end, what we find here is there's often this sort of fear of getting things wrong, and really LGBTIQ communities are just looking to see something. They've gone for such a long time having nothing and no focus, no attention and investment. So I think just to demonstrate that commitment, and to make that effort is really such an important first step. So
Wonderful. Thank you so much. And for those people who are watching, if you're looking for some ideas of where to start or where you can go, one of the areas, we've talked a wee bit about is sport, and obviously New Zealand recently stood up a Sport Integrity Commission. It has a whole lot of codes of conduct, it has online resources, it has support. So that can be a really good place if you have lay communities that are wanting to start thinking about this. And it is sport and recreation, so it does cover a whole lot of those general communities that exist out there. Okay, well, thank you so much. That was really wonderful. And I will hand back over to Cheryl to close us out.
Wonderful. Thank you. Thank you so much, Marina. Thank you, Eleanor. That was a really good conversation. I feel like we could go for a long time with that. I really want to thank you for the pride and prevention resources that you've shared as well. There's such good information, such good resources there. And I also really appreciate, Marina, you talking about us making the effort to understand and making the effort to include. I think they're two really good messages for us to keep being reminded about. We've got some good research that has happened in Aotearoa as well for LGBTQIA plus communities. And so that you can find some of that on the VINE website, the Violence Information Resource website. So if you've got any, for the people watching, if you've got any thoughts about future sessions, things that you'd like to hear, please share that with us. We'd love to hear from you. And we'd also love to see you next month, which is going to be on the 24th of September at 12 noon. And for that session, we've got Joe Robertson, Jolly Jean Brocker and Rory Birkbeck sharing the research that they've just been part of called The Digital Sexual Landscape, Children and Young People in Aotearoa, New Zealand. And so they're going to share that research that looks at how the digital world is shaping the sexual lives of young people in Aotearoa. So please join us for that. Put it in your diaries. Look out for our LinkedIn invite. That'll be coming out very soon. So I'll let you go on with your day. I'll just close us with karakia, and please let your colleagues know about these sessions so that they can join us next time. Thank you. Ia tau te rangi Māori e ki runga ina iwi Aotearoa. Haumi e, hui e, taiki e. Thanks, everybody.